Greetings, dear PMNCH partners. I hope this message finds you well. I'm speaking to you to express my heartfelt gratitude for your active engagement and contributions during the recent 79th session of the United Nations General Assembly. As a global partnership dedicated to the health and well-being of women, children, and adolescents, our presence at these critical discussions could not have been more timely or significant. I would like to share with you some highlights from PMNCH engagement at the UNGA 79. During the United Nations General Assembly, your partnership co-organized 5 high-impact events, each aimed at advancing key priorities for women, children, and adolescents. The first is our annual flagship event, the partnership's annual accountability breakfast, which this year focused on accelerating action and accountability to end preventable maternal, newborn, and child mortality. The event highlighted the urgent need for transparency and accountability in fulfilling commitments towards women's, children's, and adolescents' health. Over 25 speakers shared their commitment and shared practical insights on how to accelerate the implementation of the World Health Assembly 77 resolution on accelerating progress towards maternal, newborn, and child mortality at the country level. Our second event was captioned as Securing Health and Rights of Every Woman, Every Adolescent. Co-organized by the Global Network for Leaders, the event saw the extraordinary participation of heads of states led by His Excellency Cyril Ramaphosa and other health ministers as well. This event discussed the persistent gaps in health systems that disproportionately affect women, children, and adolescents, particularly in conflict and post-conflict settings. The discussions underscored the need for comprehensive health care, including sexual and reproductive health services, and the integration of these services into universal health coverage. The event ended with new commitments by participating countries to strengthen health systems and increase funding for SRHR services with a focus on reaching marginalized countries. A third event focused on shaping adolescent well-being beyond 2030, captioned as the Youth Power Summit. This youth-driven event, led by young advocates from around the world, focused on shaping policies to promote adolescent well-being beyond the 2030 agenda. The event led to the launch of a powerful call to action, calling for young people's voices to be central to shaping national and global policies affecting their futures. The fourth event focused on adolescent sexual and reproductive health and rights. The event explored the critical role of SRHR in advancing sustainable development, emphasizing the intersection between adolescent health and broader societal outcomes. Panelists discussed strategies for overcoming barriers to SRHR services, including legal restrictions, stigma, and inadequate funding. The event saw the launch of a new scientific publication released by the World Health Organization, which called for increased investments to adolescents' health issues, especially mental and sexual and reproductive health needs for nearly 1.3 billion adolescents. Our last event focused on the importance of robust data and governance to ensure that health information systems are effective, inclusive, and capable of driving improved health outcomes. The event addressed the challenges such as data privacy, equity, and the need for disaggregated data to inform policy making. Exchanges during the event led to the perspectives on how to improve health data governance with the goal of creating more transparent, accountable, and equitable data systems by 2025. Colleagues, as you know, this year United Nations General Assembly, alongside the discussions at the Summit of the Future, yielded several key commitments relevant to health and rights of women, children, and adolescents. These commitments were reflected in the so-called Pact for the Future, which aims to reinvigorate multilateralism and strengthen global cooperation towards the Sustainable Development Goals. Some of the key highlights from the Pact for the Future include the emphasis on achieving gender equality and empowerment of all women and girls, as crucial contributors towards progress towards sustainable development goals. The need for investment in social and economic development of children and young people so that they can reach their full potential. And also the need to take comprehensive and targeted measures to eradicate poverty by addressing the multidimensional nature of poverty, including through rural development strategies and investments in innovation in the social sector. Colleagues, the Pact for the Future also emphasizes the need to address health priorities from universal health coverage to ensuring universal access to sexual and reproductive health and rights as agreed in accordance with the Programme of Action for ICPD and the Beijing Platform and other outcome documents. Colleagues, I cannot emphasize further the need for continued action in the light of recent escalations. As we move forward, the situation on the ground remains extremely complex and ever-changing. The recent escalation of violence in the Middle East and other ongoing conflicts in various regions underscore the vulnerability of women, children, and adolescents in humanitarian settings. These events are a stark reminder that our work is far from over. We must continue to advocate for the protection of health and human rights for those most affected by conflict, displacement, and crisis. Now more than ever, solidarity and collective action are crucial. I urge all of us to remain engaged, leveraging our unique strengths as a partnership to promote peace, equity, and the right to health for every woman, every child, every adolescent. Together, we can turn our commitments into meaningful change. Thank you.